Here is my final case study. Today I'm a microbiologist at work and I see a patient coming in being brought in by her parents. I'm probably going to have to run her labs and some urine. So background on this patient. She's a 13-year-old female pediatric patient and she has an onset of fevers, high fevers, with a diagnosis of pyelonephritis based on imaging and laboratory results. The purpose of the study is to identify the pathogen and understand classification of the identifying bacteria for effective treatment and proper management. So, the doctor go ahead and collects a urine culture and draws some blood from the 13-year-old child. Urine is brought over to the lab and blood work is brought over. Tests are performed. We do an isolation streak plate, a gram stain, an agar, including mannitol salt and S-methylene, and we ran some biochemical tests, and then last, our Kirby-Boer assay tests, all being able to identify the pathogen, giving us a diagnosis and treatment plan. We were able to identify Staphylococcus aureus. The urine culture came back with positive results for staph, and it's a bacteria infection. Her blood was good, had some elevated white blood cells and CRP levels, and she was continuing to run fever. So the treatment plan for her is to be treated with a broad spectrum antibiotic, cefazolin. We're going to hydrate her with some IV therapy and continue to monitor her vital signs and lab work regularly. After doing this over several days, because of course, yes, all those tests we ran right here, the isolation streak plate technique, we had to, of course, incubate it. After the isolation streak plate, we were able to separate and identify the bacteria. We let that stay and incubate. We came back and performed a gram stain. That was able to give us a differential of gram positive or gram negative. After we had positive results, we did a differential selective test using our agar technique with mannitol salt and methylene blue, and those were colored stained. Last but least was the Cubar Kirby Busar assay test. After gathering all of this information, we were able to treat the pediatric patient with a positive outcome for her. Her fever was resolved because, of course, the IV hydration and the antibiotic given. Of course, she had to complete the whole course of the antibiotic. We ran more tests to see if there was improvement. Her white blood cell levels came down. She seemed very well hydrated. and had a positive outcome from the antibiotic therapy. Analyzing clinical dynamics of the 13-month-old girl, we were able to diagnose her with pyelonephritis. It was caused by staph, and the findings to isolate the bacteria was due to the prevalent UTI that she presented in the emergency room with the fever. And she had inflammatory responses being evident with the white blood cells and her CRP levels being elevated. We treated her with the antibiotic and hydration, and we were able to prevent further renal impairment in the pediatric patient. With microbiology studies, we're able to apply to the medical field to help diagnose someone with the disease, find out how it needs to be treated, and prevent the spread of that infection. Microbiology is able to help healthcare professionals recognize, isolate, diagnose, and prevent harmful bacteria.